20 women die every single day as a result of a disease that is almost preventable. This silent killer is known as cervical cancer. Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. Today we are looking at why women still die as a result of cervical cancer. What can be done to prevent and reduce the statistics? Stay tuned. The conversation begins after this break. The program is to Sound Health on Lagos Television. Join us via Zoom this evening to share our expertise on cervical cancer. The prevention and management is Dr. Bolanle Adegboyega. She is a consultant clinical and radiation oncologist at the medserve-luth Cancer Center, and she is also the head brachytherapy unit at the facility. Good evening, Dr. Adegboyega, and thanks for joining us.
Good evening. How are you doing? Thank you for having me. Happy New Year, everyone.
All right. Thank you for always obliging us. 20 women die every day as a result of cervical cancer. But the World Health Organization says this disease, a silent killer, is almost preventable, 100% preventable. Why do we keep having increasing statistics every day?
Thank you. Well, it's actually very unfortunate that we are still having that because cervical cancer is the only cancer that can be eliminated worldwide. So it's highly preventable, up to like 99.9% preventable. And then in the developed nations, they are now getting incidence in the range of less than 10% incidence, less than 10%. In fact, in countries like Australia, they don't do mass screening again. They only screen patients at risk. So this cancer, we should not be talking about this. There are some cancers there's nothing you can do about. There's really little or no. But cervical cancer is just so unfortunate because it's highly preventable and treatable and curable if detected early.
Okay, I'm glad you said some countries, they only screen people that are at risk. We'll get to risk factors later, but what causes cervical cancer? Why do people, ladies, women, experience this disease?
Okay, cervical cancer is strongly linked to a virus, human papilloma virus, which is sexually transmitted. And so any woman that had any sexual exposure at one time or the other is in a way exposed to this virus. And then the cause of this infection, but because if people have good immunity, you clear out the virus at every point in time. But then the main cause of this infection, of this cancer, is a persistent chronic infection of this human papilloma virus, which the body is not able to clear. And then this is common now in patients that are having maybe low immunity like HIV, or people that have multiple sexual partners. So it's common now in those that have maybe sexual workers, and then those that have early exposure to sexual intercourse, maybe the people that have sexual intercourse are earlier than like 13 years or more, or people that have partners that have multiple sexual partners. So the person might just have one partner, but the partner has multiple sexual partners. So because the more the sexual intercourse, the more the risk of exposure to this virus, and then the more it's likely to be chronic, and then the body is not able to clear it, which can eventually lead to cervical cancer. So the first step is exposure to this virus. If the body is not able to clear it, there's a precancerous stage, and if it's not detected at that level, it might invade the body and then become cancerous. So it's like a continuum, but then it's strongly linked to sexual intercourse.
All right. In your experience, have you ever had ladies that are not sexually experienced coming up with this condition?
It is very, very rare. So I would say in my own experience, I think I've seen one. I'm not so sure. She's not my patient, but it's quite rare. But never say never. I think one way or the other, it might happen. But I have not personally had, but I think a colleague has had one, but it's quite rare.
Okay. What symptoms should ladies must start looking out for when it comes to cervical cancer?
Okay, so in cervical cancer, like I said, is a cancer of is sexually related. So is a cancer affecting the mouth of the womb. So when a woman is about to deliver, the place that they check in the hospital that says 2 cm dilated, 3 cm dilated, that's the cervix. So anything there is a genital organ that is going to be affected. So when a woman starts having abnormal vaginal discharge, and so the abnormal vaginal bleeding, let me start from that. So abnormal vaginal bleeding means that maybe somebody that entered menopause, you start bleeding again, an elderly woman. So people think that it's menopause that comes back, but we tell patient menopause don't come back. Another one can be if a woman of reproductive age group start having bleeding in between your cycle. It's usually every 28 days or every 30 days that you usually have it. But now you're having bleeding like 15 day 20, and it's coming like that. And then it might be other causes, but then that's a pointer. Another one is if the bleeding, somebody having bleeding when they're having sexual intercourse, it's a pointer. Or pain on sexual intercourse can be a pointer. Another very common one is a watery, foul-smelling vaginal discharge. It is the odor is so bad. It is watery. Some of it is like brownish color, and it's usually watery, foul-smelling vaginal discharge from any woman of age group. But then it's usually abnormal vaginal bleeding, this foul-smelling, watery discharge, usually.
Because it is a silent killer, how often should women go for screening, or how often should women be screened?
Okay, so the screening, or let me say the prevention of cervical cancer, is in stages. The first stage that we are talking about, even before we get to the screening, is the vaccine against this virus, because in 99.9% is strongly linked to this virus. So if you are vaccinated against this virus, it limits the chances. So that's the primary level of prevention, and that is what we're advocating for, especially for children that have not been sexually exposed. That's where girls between ages 9 to 14, or even higher, if you have never had any sexual exposure. There are different types of this vaccine, and it's very available in the government hospitals, in private hospitals. People can buy it by themselves. So that's the primary one that we're even advocating, such that if the girls are vaccinated, the chances of getting this virus is almost eliminated, and the chances of having cervical cancer is eliminated. So for those that pass that age group, or those that be sexually exposed, then we now go to the screening. So the screening, there are also different types of screening. The commonest and the cheapest one that is used in mass screening is what we call visual inspection. That is usually done by nurses, CHU, and everybody. It's just for them to be trained and to know what to do. And with this one, you're able to screen a whole lot of people. Only that some people that are not well trained can mistake every other thing. But when they have anything suspicious, they can always scale it up to the next level for further testing, and then at times, for those that are even in precancerous stage, this is used to detect those in the precancerous stage. It can be treated on the spot and prevented from becoming a cancer. So it's usually very cheap, and then it can be done maybe every year. And then when you have now some negative tests, or you have done, it can be spaced out. Another level is the pap smear. It's also like that, but then it's more specific and a bit better. So in that case, it's also they take a swab from the private part, send it to the lab, look at it under the microscope, look at the cells, and look if there's anything abnormal. And then from there, it's also pick precancerous stage. And then this one too can be done every 1 year, 2 years. And when it's normal, you have a stable sexual partner, it can be spread out to like once in 5 years. But the gold standard now that the WHO is advocating is what we call HPV DNA. It's also a swab. But in this one, it checks if there's HPV virus there. It tells us the type of virus, because there are over 100 types of these HPV virus strains. But it's not all of them that are malignant, but there are some that are very, very malignant, that leads to this cancer, the 16, the 18, and others like that. So this HPV DNA tests the type of virus, tell you if it is the one that can cause cancer, and then that way it can be treated. So if somebody does this HPV DNA, it's also available in Nigeria. If somebody does this HPV DNA and you have a stable partner and it's negative, if I can cover you for like 10 years, so the screening can be spread to like once in 10 years. So that's the gold standard, combining pap smear and HPV DNA. But for anybody that can do HPV DNA, is actually what we're aiming for now.
Okay, between the vaccines, advanced technology that you just mentioned, there is still stigmatization, there's still myth surrounding these vaccines. Many parents are still do not accept this vaccine. They do not even allow their kids or girls be vaccinated. Why do we have this, and what do you think we can start doing to ensure compliance, to ensure the advocacy is high out there?
Thank you very much. That's a very, very important point. And then it's just so unfortunate that we're having stuffs like this. Ignorance is a very terrible thing that we're having in Nigeria. Because when we have talked about it, that developed nations have been doing this thing for years. For years. It's not caused more cancer incidence in them, and it is not caused more infertility in them, or whatsoever the myths and misconceptions we have about it. I talked about countries like Australia and other developed nations. They don't even talk about cervical cancer again the way we are talking about it. The incidence has dropped so drastically that they hardly ever have up to like how many cases in a year, and we are still having hundreds of thousands of cases and hundreds of thousands of deaths from cervical cancer for what is highly preventable. So it's just for us to see what is happening in developed nations, their success story. Even countries like India are doing much better, and then even African countries are doing much better in this than us. So now the vaccines have been provided. So it's just for people to know, people that have taken it and their countries that have taken it, and what is their result, which is obvious and out there in the social media and on the internet. So it's just for us to advise our women that prevention is better than cure. Unfortunately, the class of people that come down with cervical cancer is being linked to the low socioeconomic status. It's unfortunate that by the time they come with it, they don't have money to treat. The treatment is available. I can assure you that the minimum for those that are going to be treated, if it has not spread in Nigeria of today, by the time you add up everything, somebody is going to be looking for 5 million naira to treat cervical cancer. Of course, when I put everything together, from the test, from the diagnosis, from the investigations, from the follow-up, and the treatment, it can be up to 5 million naira for people that cannot afford it. Whereas there's a vaccine that can prevent it. So let our women know, and their mothers and fathers, religious leaders, let's tell people this thing does not kill. Countries have done it and they are doing well with it. They should go and check it. And they know that patients that are coming with it, most of them cannot afford the treatment for something that can be prevented. So we keep telling them, and I pray people get to know better.
Okay, I'm happy it is preventable. Is this vaccine affordable? I know you said it is accessible. Is it affordable? And is the disease also treatable? What is the treatment rate, the success treatment rate like?
Okay, thank you very much. So for the vaccine affordability, that should not even be an issue at all, because now it is entirely free by the federal government, the state government. It's available in all our PHCs for children within that age group. And then even if you are not in that age group, or by one way or the other you don't have the means of going there, it is still affordable. I think that, like I mentioned, there are 3 types. The commonest one, which is the Cervarix, it covers the 2 commonest strain of this HPV virus that causes cancer. That's HPV 16 and 18, and it is like 30,000 naira. And then studies have shown, well, you can take 1 or 2, you can take 2 doses, you can take 3 doses, but studies have shown that even a single dose of most of this vaccine gives coverage, protects up to like 90 to 97%. So even if it's just 1 cycle you can afford, but know that it is free in most government hospitals. But even if you are not in that caveat, you can do that. Another one is Gardasil 4 that covers another 2 more strains. Apart from that 16 and 18, it covers 4 strains, and that one too is about 35,000. Gardasil 9 is the one that is very expensive, and 1 dose of that would do, but it's very expensive. But what I'm saying is that even if it's the basic one, 30,000, 35,000 that you can take, if you are not in the range of those that can take free one, that is still affordable. Even if it's just 1 cycle, 1 shot of the vaccine is a lot. It goes a long way. So talking about the treatment of cervical cancer based on the stage, there are 4 stages of presentation. Those that come in stage 1, that is early, and they are usually people that are detected on screening, not when there's symptom. By the time you are having symptom, usually it has passed that stage. But those that are detected on routine screening, they come in early, and in most cases surgery suffice to treat. But unfortunately, majority of our patients comes in late stage, locally advanced, or even metastatic stage when it has spread. And then really, so for this stage, for locally advanced or late or advanced stages, we use chemotherapy combined with radiotherapy under 5 weeks. And then after that, we go to brachytherapy. The difference between the first radiotherapy and brachytherapy is that first radiotherapy comes from outside, from a distance. The last brachytherapy is a form of radiotherapy. We put it in the private part for like 3 times in 2 weeks. So the combination of all this treatment, the chemo, the radio, and the brachy, should be completed within 7 weeks. If we are able to meet these targets, the cure rate is very, very high. It is highly curable, and all of this can be assessed in Nigeria. With the center where I work, medserve-luth Cancer Center, has all of this. Even in the brachytherapy, we have the type of brachytherapy that is almost not available in other parts of Nigeria. And so with this new technology, everything combined, cervical cancer is curable if it has not spread. But when it has spread, is a stage 4B, then we talk about management and palliative care. But when a patient comes when it has not spread, it is curable. Thank you.
All right. No doubt, prevention is truly better off than cure, and it's also better off than all the stress you have to go through, the frequency you have to ensure that you are always at the hospital. Okay, your final words now. Any parting shot? What would you like to say to an average woman or lady out there when it comes to fighting against cervical cancer?
Okay, thank you. So my parting shot will be like it's good to know that there's a cancer that it's highly preventable and can be eliminated. So instead of running after or crying over the ones we can do nothing about, please, this one we can do a lot about. Let's go ahead and do it. Start from the prevention. Let our children take the vaccines. Even the boys should also take the vaccine. There's a type of vaccine that they can take. Maybe the Gardasil 9, it covers so much more. It does nothing. It's safe. It's been used in developed nation. And after that, screening for women of reproductive age group or sexually exposed, either the VIA, the cheap one, the pap smear, or HPV DNA. Let's get screened so that we can detect it even before it becomes an issue, and it can be cured. Then when it is now diagnosed, go to the right center. Go to the right center instead of going from one place to the other, trying all and then trying all that does not work. There are oncologists, cancer doctors all over Nigeria. Ask questions and go to the right place because it's highly curable. We should work towards not having any woman dying from cervical cancer, something that is highly preventable. And I pray God will help us to do better for ourselves this year, have some goals and pursue it. At least get screened, know what it is, then you know how to go about it. Thank you.
Thank you so much, Dr. Adegboyega. To prevent this disease, it is absolutely 100% preventable. It is a silent killer,
Yeah.
and by the time you get to know about current health status, it might be too late. Prevent, screen, and eliminate cervical cancer. You can actually beat the statistics and do not end up as a statistic. Thank you so much for your time once again, Dr. Adegboyega.
Thank you for having me.
Sound,
Have a nice day.
You too, ma. Sound Health continues with trending health report from around the world. Please stay tuned. This is where we say thank you on today's episode of Sound Health. Do everything within your means to reduce the statistics of cervical cancer. Vaccinate your friend, sisters, girls, daughters, and mothers. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.